Welcome to Take the Lead Radio with Dr. Diane Hamilton, where she interviews some of the most successful leaders, entrepreneurs, authors, speakers, and other individuals who will inspire you to take the lead in your career and personal life. And now, here is Dr. Diane Hamilton.
Welcome to Take the Lead Radio. This is Dr. Diane Hamilton, and we've got an interesting show today because it's got a medical slant to it, which is kind of unique for this show. We've got Dr. Julie Rosenberg and Sara Soulati. And Sara Soulati is a CEO of Global Cardio Care, and they have a piece of equipment that's called the Enhanced External Counterpulsation Device that's very good for your heart. And it's very interesting what she's doing with that. So we're going to talk to Dr. Rosenberg and to Sara Soulati, and we're going to do that right after this. I am here with Sara Soulati, who's the CEO of Global Cardio Care, Inc., a firm she launched in 2002 to manage physician practices that deliver EECP. Since 1996, she's been a leading authority on practice and delivery of EECP, which is Enhanced External Counterpulsion, pulsation, to prevent and reverse cardiovascular disease. Her life as a vegan makes her a proponent of plant-based nutrition. Her passion is to teach and be health coach to share what she's learned about the correlation between EECP, plant-based nutrition, and lifestyle medicine. And her goal is to help people take control of their lifestyle to reverse and prevent heart disease, a lifestyle illness. It's so nice to have you here, Sara.
I'm so excited to be on the show. I'm a huge fan.
Oh, thank you. Well, I've been watching some of the videos that you've been in. I got to see this counterpulsation, how it works. It's very interesting what your product is, and I want to talk about that a little bit. I want to talk about a few things because I'm very interested in your background and what led to you becoming the CEO of Global Cardio Care. So can you just give me a little bit on your background?
Absolutely. I went to nursing school because my father was a surgeon. My father's still a surgeon, and we come from a really strong medical family, and so I really wanted to walk into the same footsteps, but nursing school was a little bit challenging for me because it was not a lot of education on lifestyle diseases. It was mostly pharmaceutical and kind of working with side effects of medication and things like that. And while I was in nursing school, I got introduced to EECP. There was only one center in the United States, which was in Stony Brook University in Stony Brook, New York. And then there was one little clinic in Newport Beach, and there was an ad out in the paper, and my friend took the job, and then 2 or 3 months later, she introduced me to EECP, and that was in April of 1996, and that really took my life down to a completely different road, and then I was really a pioneer in the field, and I got to really learn about this process through working with the clients and teaching myself what was really going on, and so now it's been almost 22 years, and it's just been an incredible ride, developing, creating, and then having the ability to have a company and running a company that's dedicated into quality of life and prevention of medicine.
Well, what you do is really important. I'm sure a lot of people who listen to the show want to be healthier, and a lot of executives tend to get heart disease. You get a lot of bad eating, you get a lot of lack of exercise, you get a lot of things that make it hard when you're on the road and you're doing all this. I think it's interesting how, if anybody could look up this equipment that you have, because you're on a table like with these kind of like straps over you. Can you describe it? It's really an interesting process.
Yeah, absolutely. I know all about that, how it looks. If you can just imagine laying on a comfortable bed and 3 blood pressure cuffs are wrapped around your calves, your thighs, and your buttocks, and to the rhythm of your heartbeat, these blood pressure cuffs start to squeeze your legs and start moving the blood through the lower extremities and circulating the blood throughout the whole entire body. And what this therapy actually does is circulate the blood to every single organ, and if anyone that has blocked artery, it helps develop collateralization. The body actually does that. It starts developing new arteries to bypass the blockage, and it also has a huge effect on arterial stiffness, which is really high blood pressure. So it helps the body reverse that hard artery to become more elastic and supple. And the last thing which it does is it helps stimulate stem cells to come out of the bone marrow and into the circulatory system. So it's really amazing. It's not so much the treatment. I give so much credit to this human body that we have, that if you put it in the right environment, give it the right ingredients, which is circulation, oxygenation of blood, and then helping anti-inflammatory factors, which what EECP does, and then changing your lifestyle. And here you have it. Your body can really repair itself from hard arteries, from diabetes. We've seen a huge effect on patients with diabetes, renal failure. It's just circulation. And as we know, most diseases have to do with poor circulation and inflammation, and EECP addresses both of those.
So who created this practice
This
of doing
device, this device was actually invented in Harvard in the 50s by the name of Dr. Birtwell, and he was an incredible man. And they knew back then, obviously, there was no bypass or stenting back then, and so people would get heart attacks like we do today, but they had no ability to rush them into bypass surgery. They didn't have blood thinners, so it was a hydraulic water system. So imagine it was a steel casing where you actually would get in, and this water pressure would move the blood from the lower extremities and drive it into the coronary arteries of the heart muscle while the person was having a heart attack. And it was really like it actually worked, and they were shocked because the person that was having chest pain and having an MI, the heart attack, their chest pain started to go away, but the water kind of got everywhere, and it wasn't working as the way that they needed to because technology. And the Chinese took it from the water hydraulic to what we have today, which is air sequential squeezing. So calves, thighs, and buttocks, there's really a bladder inside that pumps like a blood pressure cuff to the rhythm of the heart. So when the heart is resting, these blood pressure cuffs squeeze the lower extremities and circulate the blood throughout the body, lowering the heart rate, lowering the blood pressure, but increasing blood flow. So it's been an amazing journey for 22 years, watching people get better from all different types of diseases. So it's been just something that's obviously I'm extremely passionate about, but it's what drives me is the patients and how they've gotten better from the therapy.
Well, it's interesting. This is FDA cleared treatment, which I was a pharmaceutical rep for a long time, and I had to sell blood pressure medicines. I remember peripheral resistance and all the things that cause high blood pressure. So you're bringing back some of my training in my head. But what's interesting to me is that it is FDA cleared, correct?
Yes, it's been FDA cleared since 1995, and that's when it's got its clearance. And then it was FDA cleared for cardiogenic shock and acute MI. So if you're really in a really bad state of heart attack or stroke, this is what they used it for. And it's FDA cleared for people that are having chest pain, angina, poor circulation to the heart. But basically anyone can do the therapy because, we've treated professional athletes. It's really a passive cardiovascular workout. It's timed to the rhythm of the heart, and it's just very safe. So there's definitely more modalities that EECP addresses, because if it's going to improve the heart function, if it's going to grow new arteries around the coronary arteries, if it's going to deliver more blood to the heart, what is it going to do to the kidneys? What will it do for a person that's had a stroke? And what would happen if you were diabetic and your pancreas wasn't functioning? And so at age 26, as I sat next to clients and they would come for end stage of life heart disease, I would document the improvements of their blood sugar, the improvements of their renal function and their memory and their eyes. And, after all this time, I now recognize and I can see, and we've documented all the benefits that just simple blood flow does when you deliver it in the right way.
Well, it is interesting to see such a non-invasive kind of thing. But I mean, do people do this if they just want to have just a better healthy life? I mean, how often would they do this? How long does the treatment take and that type of thing? I'm just curious.
Yeah, if you're here that you really want to do it because you have blockages of the arteries or you've had a heart attack and you're really dealing with severe hypertension, the protocol is anywhere between 5 treatments a week, which each treatment is about 1 hour, up to 35 sessions the least. We have now, because I've been in, supporting physicians doing this therapy since 2003 is when we opened the centers, but really even before that, is that we've seen the long-term effects of EECP work so much better, and we treat patients that are in their 80s that have never had any cardiovascular issues, but they do it for circulation, improvement of quality of life, exercise duration. I mean, everything in the body really, I mean, the aging process starts with the endothelium health, which is the lining of the artery. And if you can improve that artery wall, if you can keep that artery wall supple and elastic, then you're really addressing the slowing down of the aging process. So our oldest patient is 104, and we treat a lot of people that are end stage, but at the same time, end stage heart disease. But at the same time, we treat a lot of people that are in their 30s and 40s and 50s or 60s that just want to keep improving their quality of life. And there is something about that, because even when you're healthy, you get on EECP, you sleep better, you exercise better, it pumps the lymphatic system. I mean, it's just circulation, and there's definitely benefits to that.
Well, I'm thinking about like maybe if you had congestive heart failure or something like that. Usually, it used to be that your like average lifespan, if you'd had CHF, was probably like 5 years or something. I can't remember what it was. How is it with congestive heart failure?
Oh, it's so incredible, and once we're done, we'll talk about all of the testimonials that are on the YouTube channel there. This is what's the most amazing thing, because they got FDA cleared in 2005 for congestive heart failure. And because it actually pumps the blood up to the heart, areas of the heart muscle that were dead, ischemic, and, that's called the ejection fraction. Right. So the normal EF is like 65 to 75, and we've had patients as low as 19, 17 come in, and they're end stage of life, and they can't do any more surgeries, or they can't do surgery because they're diabetic or they have small vessel disease. And after 70 sessions, which you can see this gentleman on YouTube, he's giving his testimonial, his ejection fraction went from 19 to 65, and he had flown from Vancouver, Canada, from University Pittsburgh. I think it was I forgot the name of the university, but they had British Columbia. They had brought him down here because he had nothing. They couldn't do anything else. So we see an amazing benefit for congestive heart failure, and it's not just subjective. This is all objective measurements with echoes or cardiolights or stress tests. Right. That they do, and they see the before and after.
Well, that's interesting. My father died from congestive heart failure, and I can remember, they get pneumonia a lot, and I can imagine, that a lot of people could benefit from that. Now, so where is your base? I mean, where are you located?
There's two centers that do my program, and one is in Inglewood, California, which is next to LAX area, and the other one is in the West Los Angeles area, next to UCLA. So these two clinics are clinics that are physician-based, but they do my lifestyle program. And my lifestyle program is not just EECP, because first you have to make sure you have the right device. There's many devices out there, but you have to have the right EECP device. Second, you have to really do it correctly, because it is a therapy and it has to be done correctly. And then third, we add the component of changing lifestyle and making sure that people actually change what they're doing that's causing the problem. And my lifestyle program is patent pending. And so these two centers in Inglewood and in West Los Angeles are doing my program.
So people would need to come to California. They can't do this anywhere else. Okay.
Yes, as of now, yes.
Well, it's interesting that you went into this business, and you said some of the things that led to your interest in this. But I'm curious, to become a CEO. I mean, how big is your company, first of all?
Well, at some point we had about 80 employees, and now we're just trickling down to just making sure that people that are, just fine-tuning everything at first. It's a very service-oriented business. If you saw the therapy, it's very labor-intensive. And then when we're in the, African-American community, which is the clinic that we have in Inglewood, we're there because we're on a mission to really bring something to a community that never really had anything as far as prevention and lifestyle education. So we had to build the company pretty big, and everything was, what drove the company to where it is, it was just what was needed. Everything that was needed, we tried to provide for the client's needs and then at the end of the day, it ended up being this company, and we are able to now duplicate this process and take it outside of California. But we really learned all together and developed this company that is based on just the greatest service that we can give to the clients in the community.
Well, it's interesting that you're in the African American community. They have the worst hypertension, as I recall. It's like a really tough group to treat. So I think that's great that you're giving them some options, because a lot of times they just keep doing step care therapy with hypertension. They keep adding and adding and adding drugs, right?
It's so true. It's so true. And just September of 2017, last year, my data for the lifestyle program plus EECP got accepted in the American Heart Association and the Hypertension Society, and then there was a poster abstract presented, which was a severe hypertension stage 3 and 4. They measured and they saw 35 hours of the therapy and the program combined, that there was a huge marked reduction in the severe hypertension, especially for the African American community, because they have a hard time with certain hypertensive medications not working, or they have to double it up, like you're saying. So I think the data are going to start coming out, and hopefully we're going to get a publication out of it, and that's what we're submitting for now.
Well, we talk about what groups have more cardiovascular disease, and I know my family, everybody has heart disease in it. Is it genetic, and what can you do if it is?
I think that there's definitely a genetic component when we're dealing with anything that's passed on, right? And we're talking, that's epigenetics at the same time, like lifestyle diseases that are passed through the family and the DNA. But at the same time, I think it's important to look at what are the things that we're doing that are contributing it. I mean, I have really high diabetes in my family. Pretty much all my relatives were diabetic, and at a very, very young age. So I became a vegan at age 19, and I think, and not just a vegan that's a carbohydrate vegan. It's a really plant-based green diet with good carbohydrates and nuts and, legumes and beans. And really changing my lifestyle had a huge effect on me. And so I've seen patients that have had elevated cholesterol forever, since they were like 18, 19, because they had that, they had that in their family trait. And when they get on a vegan plant-based diet, combine it with EECP, get the exercise and drinking that water, I mean, we have seen metabolic issues such as diabetes, high cholesterol, obesity, all of the bad cholesterol and all the good cholesterols rising. So I really do think that just because it's genetic, it doesn't mean you're going to get it 100%. It just means that you have to do things differently. And I think having an anti-inflammatory lifestyle is definitely a part of it, and a really important part of it. And we've seen some changes, some really big changes with that.
When you're talking about epigenetics, if you've seen Ghost in Your Genes, or is it Ghost in Our Genes? I can't remember the exact name of it. Those are interesting YouTube series, and I think it's you carry on. Their theory is right that you get some of the things from your ancestors that they experienced, and they go down through generations. And a lot of it, though, I think you brought up a very important point about inflammation, because carbs are a big culprit in inflammation, and people think that if you're a vegan, well, then you could eat bread and you can eat all, but that stuff is all carbs. Totally. And that's what causes heart disease, right?
Exactly. The sugar is like way worse than anything else to begin with. Everything turns into sugar. And so that's why we really have to teach. And what we teach here is really a plant-based. And that's why we call it plant-based versus just vegan lifestyle, because we really want to address that it's more about the greens and the vegetables and the good nuts and the seeds and the good fats. I mean, we have a huge... Every day that someone comes in to get the session of 35, they listen to an audio tape, and every day there's a lesson and a handout. And for example, we talk about good fats, and we talk about hemp oil and flaxseed oil, and we talk about coconut oil, and we talk about, making sure we have avocado oil. So I think that word vegan has kind of got a little played out, and people are just running around with it. But I think it's important to address that we want an anti-inflammatory, low carbohydrate, high vegetable diet is what we're looking for.
But they've kind of changed their opinion on cholesterol. Remember when eggs were bad, and then this was butter was bad, and
Yes.
then butter's good, and then they keep going back and forth. And they always kind of stuck with the cholesterol ratio, the HDL type of being good. You want a high HDL ratio, right? I mean, you're saying high plant-based, but do you have issue with them having meat in their diet if they do it in moderation?
Well, for us over here, because we're dealing with, most of the population here is dealing with, they've had a heart attack, they have heart disease, they've had bypass, they've had the stroke, they're diabetic, they have high cholesterol, we're dealing with metabolic issues already in place. Mm-hmm. And so we're really focused on, we want the fat. See, the point isn't not to get the fat, because the brain needs the fat.
Right.
And so we focus on having the plant-based diet and having a brown, low-carbohydrate diet and lots of legumes and lots of nuts. But we focus on getting the good fats. And that's why I mentioned that whole day that we have on fats, because we need that for the brain. Mm-hmm. And so it's not so much that we needed the animal fats, it's just that we needed the good fats. And so our patients that come in here really do have a low HDL, which we want to make sure, because the HDL particles are the ones that go grab the LDL particles out of, mm-hmm. Of the arteries walls. So and most people have low HDLs, but when we turn on the whole story and we educate them about the good fats, and everybody starts taking like the hemp oil, like flaxseed oil is the highest omega-3, and hemp oil is the highest omega-6. And if we start adding that into their diet with coconut oil, not cooking any of these, but just actually drinking these in their salad or in their shakes, we start seeing a really giant elevation in HDL. Like my mm-hmm. HDL is 90, which is really, really mm-hmm. high, that is high in general, but especially, and men have a tendency to have a lower HDL. So mm-hmm. this process has worked for us over here. And so we have data to show that getting off the meat, getting off the inflammatory foods, sugars and meats and fried foods and things like that, and adding the good fats and bringing that fresh, organic, obviously, and non-GMO products has made a huge, tremendous, benefit for their health.
Well, yeah, I could see that would definitely help. I have a high HDL as well, and that, even though my cholesterol is high, they'll always be, your ratio is so great, so nobody really worries about it, I guess.
Yes, that's beautiful.
But, my family tends to get visceral fat, which is a bad thing too. And I think I meet a lot of people who have visceral fat and they don't realize the damage that could do, because visceral fat isn't like so towards the surface where it rolls, so you don't really look fat. You kind of just are big and thick. You know what I mean? Because you've got fat around your intestines, right? Is that kind of what it is?
Right, and that's exactly it's this fat around the intestine, but at least it's not in the artery walls.
Right. Yeah. Well, none of it's really that great, but it's interesting to know that you guys are doing all this stuff. So I'm interested, what's next for your company as a CEO? What do you have planned for growth? What's your vision?
Well, like I mentioned a tiny little bit, I mentioned to you about not all devices are the correct device as far as EECP, and there's about 5 or 6 different manufacturers in the United States that are now creating the device of EECP. The machines that I use are the original machines that were FDA cleared in 1995. So you can imagine how old these machines are. But there is, major 5 or 6 components of why EECP is successful. And unfortunately, the new manufacturers are going towards, how technology, making it portable, making it cute and pretty, but they've forgotten the essence of why EECP works. So I'm actually moving into, I have my own manufacturing. I connected with the original manufacturing company, and so I'm excited that I'm going to be able to make a really great line of EECP equipment that are really going to work, and we're able to put these around the United States, combine it with my program, so then people can license the program, license the therapy, and bring this into their hometown. So we have a lot of support out there that are looking to bring this therapy into their neighborhood, but making sure that they've got the training, the support, and the program, and the right machine combined.
Do you sell to chiropractic offices, family physicians? Who's your major?
Anybody that is interested in that, we sell it to them. We have a list right now. The machines are under FDA clearance because it's the 3rd generation. of the same device that I have. So it should get FDA cleared this year, but we are starting to speak to a lot of people internationally that we can place the machines now. But pretty much anyone that is interested can put a device in their office, and even homeopathic, naturopathic MDs can do it and can have a facility that has the therapy.
Well, what if they're just a nurse practitioner or a nurse, or I mean, how high of a level of do they have to be able to handle this to be?
No,
capable?
I think the thing with EECP is that you can get. I mean, even a person that is a business person could open up a clinic, hire physicians, get the physician team inside, and then get the training and hire technicians to provide the therapy.
But do you need a physician to oversee it, or can they do it without physicians?
You do need a physician. It just depends on if you're going to go with insurance. Everything is based on insurance. So if you're dealing with certain insurance companies, you need to have a physician on staff. If you're going straight for cash and you're doing for prevention, I had mentioned that I had, worked with the professional athletes. I sold a machine to the Miami Heat. There is a huge component of EECP in sports. So you can do it. Just there's different laws, different states as far as how the structure needs to be put in place.
Yeah. Well, that's good to know, and I think a lot of people are going to want to know more about this. Can you share your site information, how they could find out more?
Absolutely. I think the place for people, just because I'm speaking about all this, and it's always so good to go hear from other people. So the YouTube channel, Global Cardio Care. If they go on YouTube and punch that in, I think it's great because they can see all the testimonials of what people have gone through. And then obviously globalcardiocare.com, where they can see the 2 centers that have my program and they can read a little bit more about it. But I think anyone that's interested to even try it out in their Los Angeles area can call the centers and come in and get a free experience of the program. And we allow people to come in and get a complimentary experience.
Well, this has been really fascinating, Sara. Thank you so much for being on the show.
I am so grateful. Thank you so much. I really enjoyed speaking with you, and anytime I get a platform to share about something that's so life-changing, I'm really grateful for that. Thank you so much.
Oh, you're welcome. And we'll be back right after this message. Well, this was an interesting show. Thank you to Julie and to Sara. I really enjoyed listening to both of their company stories and what they're up to. And I have so many fascinating guests on this show. If you've missed any past episodes, you can find them at drdianehamilton.com. You've been listening to Take the Lead with Dr. Diane Hamilton on C-Suite Radio.